Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I am your host, Kurt Barwis. Today I have Ray Gorski and Darius Arami, both from the facilities department at the hospital, both responsible for keeping our buildings, our infrastructure in great working form, and both responsible for the amazing work that's happened at the hospital. If you've been there lately and seen our new rooms, the new emergency room, everything is just absolutely incredibly beautiful at this point in time. So Darius, why don't you start? Tell us a little bit about yourself.
Again, I'm a Hartford native, went through trade school, worked at a couple of hospitals. I have 30 plus years in facilities. I'm one of few certified healthcare facility managers in Connecticut, proud to say that. Have a great family, live here in Farmington, actually, and I moved from a larger hospital system to Bristol Hospital a little over a year ago, and I want to say it's probably the best move I made.
Wow.
The atmosphere here and the people are just unbelievable, and it's an environment that I didn't come from. So
we're really happy to have you on our team, Ray. I can tell you that. So what trade did you
I'm
start?
an electrician, but I try to have
You're
my
an
master's.
electrician.
I have my master's license in electrical here in Connecticut. Awesome. And had it for many years. So
it's always great to have a trade person at the top of the helm, over the facilities department. And Darius.
Yes.
Tell us about yourself.
Well, I was born and raised in Bristol, probably 2 blocks from the hospital. My father was a physician at the hospital growing up, but I ended up going to school for culinary arts and food service management. Got a job at the hospital where I worked. I worked there for about 10 years. I went out and explored my options out in the field, and then I gravitated back towards the hospital where I met you, my other bosses, and natural progression. I was running the kitchen, and then just as years progressed, I was highly encouraged to go back to school, which I did, and and here we are today. I oversee about 10 departments at the hospital, and I love working there. I mimic what Ray says. The culture is awesome, and just happy to be part of the Bristol Hospital family.
Yeah, and this was last year. You accomplished a major feat. You became a fellow of the American College of Healthcare Executives.
Yes, I did.
That was a lot of work.
Yeah, it's one of my big, most proud moments.
Yeah, I think for the whole organization. So it's not an easy thing to pull off. So we're over 100 years old now. I don't think the building that we started in is part of our campus anymore. I know it's not part of the campus over on South Street, but the main buildings are pretty old, and the challenge is always keeping them in great operating form so that we could take care of the public. So talk to me a little about what it takes to do that. What's the team like? How do you manage to do all these things that you have to do and deal with all the regulatory agencies that come in and look at us on a pretty routine basis?
That's definitely a challenge. That's definitely a challenge. Fortunately, I have a good group of tradesmen who really do just about everything. But taking care of a large facility, really the major focus is on preventive maintenance. If you don't do preventive maintenance, that's when your equipment is going to fail. And then identifying equipment that's at the end of life or close to the end of life, so that we can schedule replacement in an orderly fashion instead of waiting for it to break down. So the regulatory piece is a whole nother big piece of the puzzle, where we have so many requirements for inspections and testing and whatever. But we have a preventive maintenance program, or excuse me, preventive maintenance program that puts out work orders, and then to keep us on track to do that. And then it's the managing all the paperwork and having it all prepared for when our regulatory agency comes to visit us and ask us for all these things. So.
Yeah, I think people, I know myself, when I go into an environment, I don't really process, how much work goes into making the environment safe. So we have extensive behavioral health units. We have a locked unit in the ER, a very special unit, and just those particular units come with just incredible regulations in order to keep patients safe in those environments. And then you kind of go over to, for example, the pharmacy, and where they're mixing chemotherapy drugs or whatever, and we have to have a clean room in that environment. And so, when you say the complex regulations, it is beyond complex, because you have to become like this expert in very unique areas. I mean, laboratory, pharmacy, the OR environment is just incredibly complex because of making sure that we reduce the potential for infections and transmission and things like that. So, so you must read a lot.
I do, but behavioral health units, really, I've become kind of I won't say an expert, but pretty knowledgeable about it over the years.
Yeah.
Where I previously worked, we had a 65-bed behavioral health unit, and I was fortunate enough to be there when we did a number of upgrades to address the, let's say, numerous problems that were identified by our regulatory agencies, but we're overcoming. So now I bring some of that, expertise to Bristol, and we've identified a number of things that we can take care of ahead of time. So the pharmacies and ORs, you're correct, Kurt, they have their own unique requirements: temperature, pressure, humidity, and they vary from pharmacy to OR that we have to watch and maintain on a daily basis.
Yeah, the air systems, the exchanges, all of those things are even in the patient rooms. And going through the pandemic, I mean, you guys, you were able to change whole floors from positive pressure to negative pressure to create a much safer environment, so that we could reduce or almost eliminate the transmission possibilities through the air. We didn't really know what was going on in the beginning, how COVID was transmitted. I mean, there was just so much we didn't know. So Darius, you have like a lot of the hospital now, and the facilities part of it has been, and Ray, you didn't come when we started the ER. That was a long project, But talk to us a little bit about the ER project.
Well, I mean, it's a project that probably took us about 3 years. It was probably 5 or 6 years in the planning. It was really collaborating with Ray's team now, the facilities team, and understanding the infrastructures and the different things that we would need to pull this off. And working with we partnered with Phase Zero, and our architect, and Bismarck Construction, who really just brought the whole thing together. There was a lot of, we had meetings after meetings, bringing in different teams, like the ER staff, the nurses, the doctors, the support staff. It was just a lot of collaboration, weekly meetings, until we got it right, and then we would implement things, and then we'd have to revisit them when, it's trial and error, and we think we really nailed it, and we got probably one of the, if not the best ED in the...
I would go there.
Go
ahead.
No, I would. Absolutely, yeah. Definitely the best ED in the state.
Yeah, we went from probably the worst.
Absolutely.
Although I have to say, despite the fact that the environment was not exactly, refreshed and looking good, all the time. Not that it wasn't clean and in good form, just it looked old. We still ended up having some of the highest scoring patient satisfaction outcomes in the state of
infection
Connecticut.
rates, yeah. I mean, the biggest challenge was probably really the size. You know, we had a lot of double rooms. We started off with just right around 13,000 square feet. We blew out the walls. We added another at least 8,000 square feet in total.
Yeah.
Actually, about another 11,000 square feet in total with the behavioral health unit. It currently sits at about 24,000 square feet overall. We went from all double and triple rooms in some cases to all single rooms and spacious. You know, they're designed with the patient in mind and the staff really. So they have room to move around. They're just really state of the art.
Yeah, it's really exciting to go down there, and I think the interesting time for me was during the third wave of the Omicron variant of the COVID virus. And I never thought I'd ever see that ER full. And we hadn't opened the old part got renovated second. Yeah. But there were 100 people in that ER one night. I think I was there at 8 o'clock at night, and it was just to see that and to see, I can't imagine having had that visual, what it would have looked like if it was the old ER. It would have been an absolute mess. And every ER in the state was just overrun. And it was February, February of 2022. And I was calling other hospital ERs, seeing if they could take patients, and there was no availability. It was just absolutely a mess. But having the new facility, having the resources that are in that new facility, at least a half of it that was open, was just incredibly powerful to taking care of patients.
Yeah, and you have a really good team down there. I mean, you have a rock star ED team, and I think it's really what made it all possible, that and the space. Yeah. And yeah, it was a pleasure to work with them all.
So one of the interesting things that Darius, you kind of advocated for before the pandemic, we hadn't really done anything to renovate our med surg floors the colors kind of tell the story. It's mauve. It was mauve, and we're talking. I can only guess it was the 80s, late 70s, early 80s.
Yeah.
That anybody did anything, and you kind of looked at it and said we had gotten estimates, and obviously as a freestanding organization, it's not like we have incredible access to capital. You went out and said, look, we can buy all the materials for this. If we buy it all at once, we can get it at a reasonable price. And somehow, some way, we figured out how to do that. And then you put together a plan that included hiring the trades. And literally, that also helped us with the pandemic, because all the modifications we had to make, you had teams there. And then you renovated a whole floor pretty much during the pandemic.
A floor and a half.
A floor and a half.
We had 44 rooms that we needed to do. I think we have 8 left. The beauty of it is really, we didn't have to close down a wing, right? We didn't have to close down a wing. We did stacked rooms 2 at a time, and we never really disrupted patient services, Yeah. We did our, we isolated the rooms, and we went to work, never losing.
So what all did you do to those rooms? I mean, I think people that come in now, they see the cosmetic piece of it, the bathroom, the floors, the walls.
Basically, floor to ceiling, they're renovated. There's new floors. There's new, we've patched and painted all the walls. We've refreshed the head walls. So we're using the existing gases and stuff like that, but we just made, we had them inspected and brought them up to today's standard. New ceilings, we did have we have what's called pan ceilings with coils in the ceiling. So when there's just extreme temperature changes, it would draw condensation. So we've eliminated all that and all the issues that go along with that. So each room is now temperature controlled, individually temperature controlled per patient. So it's really it's a fantastic upgrade of the overall patient experience. We put in smart TVs. We have the capability of growing that system in the future. Just everything. The brand new bathrooms, walls. Yeah, a lot of the utilizing a lot of the existing structure, just really facelifting everything.
And you can see it when you walk on the unit, and if I visit patients and stuff like that, they're like,
Yeah, it's
wow,
amazing
this
to
is
see the difference.
amazing.
Yeah.
And not only that, you captured some of the main floors, lobbies, and the materials too that you use, because we had done the elevator lobbies and thought we had it solved for 10 years, but the materials didn't last very long at all.
Right.
So you spent a lot of time studying what kind of materials should we use so that we get the durability and able to clean it and all that kind of stuff, and then have the equipment to take care of it. It's amazing how much goes into the renovations in an environment such as a hospital. So what's in the future? What do you think? I mean, you're always asking me for money. You're always saying, can we do this? Can we do this? Can we do this? And we're very fortunate to have tremendous philanthropic support. I don't think the ER would have been possible without it. And what a tremendous capital campaign. And we continue to have philanthropic support. So talking about, what do you see in the future?
I mean, in the near future, we have several projects going on right now. Working with Eversource and Bloom Energy. We're in the middle of installing fuel cells, which is going to save the organization a ton of money and reduce our carbon footprint and energy bills. And it's going to sustain our cost structure for electricity for the next 20 years. So that's one of the projects that we've just tackled. We're in the middle of. We just installed EV chargers throughout the campus. Those are going to go. They're actually being inspected tomorrow, and they're going to go live in the next couple of weeks.
I did see somebody's car plugged in the other day.
They're not active, so. They shouldn't be.
I had it plugged in all day.
Yeah,
but it's not. They're not active.
Really?
Yeah.
That's too funny. I walked past it and I was like, wow, they're already using the EV chargers. I wonder how that, how that system works, how you pay for it. But that kind of startled me.
Yeah, I mean, I had a long conversation with ESC, who's helping us with this project. It's really interesting. My biggest concern with the whole thing was like, how we're going to get these people, someone's going to come into work, they're going to park there, and then they just think they get to stay there the whole day. So there's actually systems that give the employee, patient, visitor, whoever's using that charger, it'll send them an alert that their car is now ready to be moved.
Wow.
Yeah, and then we put in some signage. So that's an exciting upgrade for the campus. We're looking at solar energy, we're looking at I think it's a 124,000 kilowatt system that's going to help supplement costs of the perioperative center. The fuel cells is really focused around the main campus, and so we thought, looking at solar for the perioperative center. It's gonna, again, reducing our carbon footprint and saving money for the organization.
Yeah. How much money the fuel cells? What's the I forget what the number is per year, but it's a significant amount of savings.
Yeah, I mean, it's projected to save us at minimally $350,000 to $500,000 a year in energy costs.
Wow.
Going forward, yeah.
That's just absolutely incredible. I was recently at the American Hospital Association meeting, and one of the things that hospitals across this country are being asked to do, because they are not good carbon footprint organizations at all. Tremendous amount of medical waste, disposables, plastics, you name it. It's just enormous. And so we've been asked, along with all the other hospitals in the United States, to make this commitment to becoming more friendly, environmentally friendly and green. And I think that it's really important to make that statement, because then people start to think about, well, how can we do things differently? We always kind of say, well, because of this, well, we have no other choice. But I think manufacturers and industry as a whole will kind of rally behind that and help us become a more, more appreciative of our carbon footprint and do things a lot better. But
We do some of that in other ways too, Kurt, because again, we take advantage of, we do a steam survey of all of our steam traps and piping and whatever like that. And then we have a company comes in, they give us a proposal on how much it's going to cost to put it in, but the incentives from the utility, but how much it reduces our carbon footprint because how much less natural gas we'll use or electricity we'll use. So we've been taking advantage of some of those opportunities too. And again, another way to reduce our carbon footprint.
So you're talking about steam sterilizers, instrument sterilizers, things like that?
Just steam in general for the entire campus. I mean, our heating systems, our domestic hot water, our heat off that, our clean steam generator for the Perriott, surgical for central sterile. But yeah, all these things that we do to repair stuff down ahead of all that stuff, saving us money. So
it's really important. I remember one of the things that I learned was you can't put hot water back into the system of a certain temperature. Yeah. So we were running cold water 24 hours a day to reduce the temperature of the steam cleaners, whatever they were, or something in the kitchen too. And it was like 1 million gallons of water a year. But that's the way it was designed.
Yeah, that was the refrigeration system.
The refrigeration system.
Yeah. We've actually started converting over the years. We're converting to air-cooled systems instead of liquid-cooled, yeah.
Yeah, and I mean, and if you're conscious, it goes back to the point that I think really hit me when I heard the discussion about this at the American Hospital Association meeting. It's like, there's so much we can do if we just consciously think about it. And obviously our environment is being challenged quite a bit right now with global warming and things like that. So anything we can do helps. So Ray, what's next on your list of priorities? I'm curious.
Well, we have some exciting things coming up with a generator project coming down the road, a rooftop air handling unit that will take care of all of our ORs.
Yeah.
Looking at potential for upgrading our C-section room and making it for dual purpose other than just that purpose. So again, a lot of exciting things. Just we're working on a facility master plan, Darius and I and Albert, our associate, and which is I would say quite a large task that we've been embarked with for about 8 months now, and starting to come together. And that's for the hospital's future and the system's future, hopefully for the next years to come. So.
Yeah, there's a lot of opportunity, and it requires a lot of grant support and support from philanthropic individuals. And the thing that's kind of interesting about it is, and I get this question, is like you talked about the rooftop units on the OR, splitting that system out, going through the process. We were fortunate enough to get ARPA funds for that through the city. And people were asking me like, well, what's going on? The engineering involved in doing it and then the bidding process and all those things take a lot of time. It's not like I'm going to go out and buy a new ambulance or something like that, which and you can tell when the order is. This is really complex stuff. So gentlemen, thank you very much for being on the show today. I'm sure we could have spent quite a bit of time on some of these future projects and talk about the world that you live in, which is, again, just incredibly complex. This is Bristol Health Cares, Bristol Cares. And really happy to have you with our show today. I want to thank Nutmeg TV for sponsoring us and supporting us and really putting us on, and encourage you all to support Nutmeg. It's a great community asset. Please write us with your question, cares@bristolhospital.org. If you have any, we're happy to address a topic or create a future program around things that you're interested in. This is Kurt Barwis, President and CEO of Bristol Health, signing off today. Have a wonderful day. Take care. I'm your host, Kurt Barwis. Today, I have a very special guest, Dr. Andrew Lim.
Hello and welcome to another episode of the Veterans Corner. My name's Chuck Wooden.
Decision for ourselves for this week if we want to be made well.
Hi, welcome to the crack of dawn. It's Dawn Lombardi. I'm starting the painting. It's going to be the cliffs with some water. Love it.
He took me on the sets of Lost in Space, Batman.
Everybody has a story. What's yours? Until next time.